Good morning, everyone. Welcome to Cover Richmond. Hello, my name is Shasa Curl, Administrative Chief in the City Manager's Office. I'd like to welcome you all today. Thank you for joining us. I'd like to introduce Mayor McLaughlin. And again, thank you for coming. And today's presentation will be available online at KCRT. And so today's presentation is being recorded. Thank you.
Thank you, Shasa, and welcome everyone. I'm Gail McLaughlin, Mayor here in Richmond, and so good to see everyone this morning. So glad this is going to be online as well with this recording so that even more residents can see this. But thank you all for being here in person. Taking the time out of your busy schedules to come and, get more acquainted with all the wonderful things that this event is going to share with you. So I want to thank Lifelong Medical Care and Community Clinic Consortium for all their hard work and their commitment to a continued partnership with the City of Richmond. As many of you know, the city has made some great accomplishments in the last few years that support our goal of health equity. Health equity meaning everyone deserves the right to health care. It's truly a right, and everyone deserves access and the best possible health care. So toward that end, in the City of Richmond, we have adopted a community health and wellness element as part of our general plan. And this is really the most extensive health and wellness element that any city in the U.S. has adopted. So we're very pleased about that. And we're currently working with UC Berkeley, Professor Coburn, and the school district and the health department and community-based organizations as part of what we call the Richmond Health Equity Partnership. And the aim of this partnership and all these partners, community-based, school district, et cetera, health department, is to develop a health in all policies strategy with the aim of helping Richmond and developing full-service community schools in Richmond. So it's both for the city and for our schools. And what health in all policies means to me is that in every policy that we develop in the city of Richmond, we have to make health front and center. So that's an important thing for us all. So it's clear that the City of Richmond is committed to helping provide health coverage and providing for the health needs of our residents. This Cover Richmond effort that we're taking on today is part of this larger endeavor. So this whole thing is just part of the larger effort we're doing in the City of Richmond. So today what you will have is so many interesting presentations. You'll learn about how to enroll and become eligible for the Affordable Care Act. You'll learn about low-income health programs. You'll learn about creating a healthy lifestyle. And of course, you will have, and one of the main presentation is the Affordable Care Act presentation, but you'll also have the opportunity to do Zumba. And you'll have the opportunity to, and that's thanks to Maria Barrera. And you'll also be seeing performances by Son de la Tierra from the East Bay Center for the Performing Arts. So a lot on the agenda. Of course, there's healthy refreshments and snacks out there. Thank you again for coming. Thank you to all. Thank you to Shasa and the City Manager's Office who has really put this together. And with that, I will introduce the next person on the agenda, who is Jennifer Arevalo from the Community Clinic Consortium.
Hello, thank you. Again, my name is Jennifer Arevalo. I work with the Community Clinic Consortium. We are an organization who represents community clinics both in Contra Costa and Solano counties. And today we have one of our members here, Lifelong Medical Care, and they will also be talking to you about the services that they offer at their health center. I will briefly talk to you today about the Affordable Care Act, what it means to you, and how you can access the benefits available to you through this reform. So first, let me talk to you about what healthcare reform is. Many of you have heard it in very different terms. Some of us call it Obamacare. Some of us have heard it as ACA. And others of us have heard it as healthcare reform. It is a law that was signed in March of 2010 by President Obama, and its official name is the Patient Protection and Affordable Care Act. So the next thing I'll talk to you about is some federal changes. These changes affect all those throughout the states, and it does not take into consideration anything that has to do with immigration status. So these consumer protections that I'll talk to you about all have to do with, are benefits to somebody who is a consumer of health care. And I am going to. So the first protection that you see here is the denial of coverage for children under the age of 19. It is now illegal for companies to deny coverage to children under the age of 19 for pre-existing conditions. This could be something as simple as asthma or diabetes. And this change will also take effect for adults beginning January 1st, 2014. The next thing you'll see here is a lifetime cap on how much care someone may be able to receive from any healthcare insurance. So previously, healthcare insurance plans would be able to put a lifetime cap on the amount of care that someone could receive. What that means is, I'll give you an example. If I was a patient who has a health plan, I won't specify any name, but I have a health plan, and the max that I can use, or the max that they will pay in my healthcare services over a lifetime will be $100,000. If I went over that $100,000 by the age of 30, I would be paying for all of my costs out of pocket. It is now illegal for insurance companies to do that. The next example is relative, and this is a cancellation of coverage because of someone getting sick. And this would happen when someone was ill and they were severely ill, needed a lot of treatment. I'm going to use the example of cancer. And what insurance companies would do is they would cancel the coverage when somebody was really ill. And now it is illegal for insurance companies to do that. The next thing is insurance companies must justify a premium raise if it will be more than 10%. So previously, insurance companies could raise premiums without necessarily having to justify that reason. But now they must justify it to 2 state agencies prior to raising that premium by more than 10%. The next thing you'll see here is what we call the 80-20 rule. And what this rule is that insurance companies now have to spend 80 cents for every dollar that you give them on you. You will not receive a check that's 80 cents per dollar that you give them, but what you will get is a larger provider network or better services. So in that way is how they are serving you by giving you 80 cents per dollar. And we know that nearly a million insured Californians have benefited from these services or these benefits. The next 3 points I'll talk to you about are also changes that have happened nationwide. The first one is one that has to do with keeping young adults insured up until the age of 26 on their parents' insurance. So previously, insurance companies would say, okay, we can have your children, but maybe only up until the age of 18 or 20 or 23, but they have to be in school, okay, at least part-time. This is not something that is negotiable now. Children up until the age of 26 can stay on their parents' insurance. They do not have to be in school. They can be pregnant. They can even live outside of your home. The only thing is that they must not be older than 26 years old to stay on the parents' insurance. The next thing is free preventative services for women with private insurance. So women are now eligible to get free preventative services. We're talking about our pap smears or our mammograms. And the last point here does take into consideration immigration status. This is the only point in the last 2 slides that I've talked to you about that does take into consideration immigration status, and I want to be clear on that. What it is the individual mandate. The government, back in June of 2012, took this case up to the Supreme Court, and the Supreme Court decided that it is okay for the federal government to make it a law that every citizen and resident of the United States must have health care insurance. And so if you are somebody who's undocumented, this does not apply to you, okay? How did they make it a law? They included what they call a penalty. And the way that somebody will be penalized if they do not adhere to the law is a penalty through their taxes. So the first year, you'll see that somebody who is an adult, 2014, may have to pay $95 to the IRS if they do not have health care insurance for the 2014 year. $47.50 for a child, $285 or 1% of the family income, whichever is greater. In 2016, if somebody chooses not to have health care, they will be paying $695 for an adult, $347.50 for a child, $2,085, or 2.5% of their family income, whichever is greater. And the one thing that you'll want to remember here is just what you see there. You can pay the penalty, but you will not have health care insurance. So if you choose to opt out and not adhere to the law, then you can do so. You can pay your penalty, but when you need to access care, like receive a doctor's visit or the emergency room, you will not have health care insurance to help you cover those costs. The next thing I'll talk to you about are changes that are happening here in our state. And I want to make a point here because in our state, things are a little bit different than in other states. And so I want to be clear that these changes are specific to our state and that if you're talking to a relative or a friend in another state, they are experiencing healthcare a little bit different than you are. So the options that we'll talk about here today may be different for your friends and families in other states. So the first is the Medi-Cal expansion. The first thing I'll talk to you about is how they've changed the program. Adults are now eligible between the ages of 19 and 64 with income up to 138% of the federal poverty level. You see the example of the income there for an individual at $1,300 or $2,700 a month for a family of 4. Outside, Lifelong has a really great brochure that has the FPL guide so that you can look up your own family size and that federal poverty level and find out if whether or not you are eligible for Medi-Cal, or you may be eligible for Medi-Cal. And this is for childless adults even. So previously, Medi-Cal had some rules and some regulations that you had to be pregnant, you had to have children in the home. Those things are all gone now. The only thing that you need to worry about is your family size and the income that you make. And for children, the income goes up actually quite a bit higher. Children with family income up to 250% of the federal poverty level, which you see there for a family is about $4,900 a month. If a family of 4 does not make more than that $4,900, their children may be eligible for Medi-Cal. The next I'll talk to you about is what is hot on our plate right now, and you guys have heard it maybe in some commercials, you've seen it on some radio or heard it on the radio. It's what we're calling Covered California, and it's what we call our marketplace or exchange. And what I'll talk to you about first is give you an example of how you want to think about this marketplace. Think about it as your grocery store, okay? You walk into Safeway and you look at your apples, and the green apple is, the non-organic green apple is $1, okay? And your organic apple is $1.30. It's your choice which apple you want to choose, okay? Think about Covered California in that same way. You're going to have an opportunity to buy health care insurance by putting in some of your family dynamic information, and then the system will let you know which plans are available to you, and it'll be your choice which plan you want to choose. So Cover California is a program, it's a system where you will enter some information, but it is not a health plan itself. The health plans are those offered within that program, and I'll talk to you about those. But first, let me mention to you who is eligible to apply for this. It is those individuals who are uninsured, citizens, or lawfully present immigrants. It could be for somebody who is already insured. They have an option to look inside of Covered California and find out whether or not their current plan is what they are calling affordable. And unfortunately, at this time, it is not for those who are undocumented. There are 13 health plans, 12 health plans with which Covered California has contracted throughout the state. And here in Contra Costa, there are 5. Blue Cross, Blue Shield, Health Net, Kaiser Permanente, and Contra Costa Health Plan. Those are the 5 health plans available to you if you choose to apply through Covered California. Each one of those 5 mentioned health plans that I just mentioned to you here in Contra Costa must offer to you, the patient, 10 essential health benefits. And you see them here. I won't read the whole list, but I'll go through a few. You have your emergency services, prescription drugs, you have maternity and newborn care, and the last one I'll mention to you is special. It's the number 10, what we see here as pediatric services, which is your medical. It also includes oral, so your dental and vision care. So for children who are eligible for this program, who are eligible to apply through Covered California, they will get 3 things: medical, dental, and vision. At this time, only medical benefits are available for adults. So what are we mentioning then when we talk about Covered California? If all the health plans have to offer all these benefits to you, then your only choices are based on the provider network. Is your doctor in a provider? Is he contracted with a health plan that is available through Covered California? The cost. Will I be able to choose one of these health plans and be able to afford it? And lastly, the quality, right? The quality of the health plan, the health care that they offer to you, the services that they offer to you. Here you'll see a chart that talks to you a little bit about the amount of coverage that the metal tiers inside of Covered California are available to you. So there are 4 metal tiers within Covered California. They are platinum, gold, silver, and bronze. And what you see on the orange bar here is the amount that you will pay out of pocket when you actually go see the doctor, versus the blue, the amount that the health plan will pay when you go see the doctor. So this is your out-of-pocket expenses. But what you'll also see on the bottom there is that the amount that the premium might cost. So if you choose a platinum plan, you'll pay a high premium, but low out-of-pocket costs when you go see the doctor. Versus your bronze, you'll pay a very low premium, but you'll be paying high out-of-pocket costs when you go see the doctor. If you choose to apply to go to Covered California, you have 2 types of assistance available to you. Financial assistance is available to you by the government, our federal government. And what you'll see there is the first one, what we say the premium tax credit. This premium tax credit is available to anyone as long as they are not over the 400% federal poverty level. And you see the income amount there. For an individual at 400%, that would be $3,800 a month. For a family of 4, $7,800 a month. If the individual or the family does not make more than that amount, they would be eligible to receive premium assistance. The second option is what we call the cost-sharing subsidy. Couple of things to note here. This will reduce your co-payments and deductibles, but you have to choose a silver plan. And you may not have income higher than 250% of the federal poverty level. And you see the individual and family incomes there, $2,400 and $4,900. Only available through Covered California, Okay. How will you apply? There are 3 ways that you can apply. There is a single streamlined application online right now, and the website to go there is coveredca.com. Make sure that you do not go to coveredcalifornia.com. It's coveredca.com. That's really important. The next thing you can do is you can call. There are 3 call centers throughout the state that have individuals taking phone calls and providing information and helping people enroll. The phone number is there, 1-800-300-1506. And lastly, there's in-person assistance throughout the community. There are community-based organizations who have contracted with Covered California to provide in-person assistance. Lifelong Brookside is here today to talk to you about that. They are here and available to provide that assistance to you. The enrollment period has already begun. It began October 1st, and it ends March 31st. If you are a citizen or a lawfully present individual, you must have health care by March 31st of 2014 in order to abide by the law. The last thing I'll talk to you about is a local program. It's what we call the Low Income Health Care Program. It's LIP for short. An individual with income between 0 and 200% is eligible for this program. The person must be an adult between the ages of 19 and 64. They must reside here in Contra Costa County in order to be eligible for this program. They must be a citizen or a legal resident with a minimum of a 5-year stay. They may not be currently enrolled in a full-scope Medi-Cal managed care program or an HMO or a PPO. And they may not be eligible if they were enrolled in a HMO or PPO in the last 3 months. The cost of the program is somewhere between $0 and $75 every 3 months. These are some of the items that may be asked of you to provide if you choose to apply for this program. Proof of California residency, proof of income, ID. These are some options on how you may apply. You can go to your local community health clinic. So we have Lifelong Brookside here, and in Central and East County, you have La Clínica de la Raza. Or you can call the Contra Costa Financial Counseling Office, and the phone number is there, 800-771-4270. Here are some next steps. If you are eligible or you know someone who is eligible to enroll into LIP, you should do so as soon as possible. They will stop enrolling December 31st, 2013. Save the date. The open enrollment ends March 31st. You should enroll as soon as possible. Begin the process as soon as possible. And then lastly, find out more information. And there are some resources here on this slide. We have a quick guide of what I spoke to you about today on this brochure here, which is on Lifelong Brookside's table outside. That is all. Thank you.
Okay, thank you very much, Jennifer. We'll now go ahead and turn it over to Lucia with Lifelong Medical Center.
Good afternoon. Thank you so much for coming out to hear about this very important Affordable Care Act information, because I think there's a lot of misinformation. So hopefully you get the information that you need so that you can share with your family and friends. My name is Lucinda Brannon-Bazile, and I'm Regional Director for Lifelong Medical Care. So what I want to do is just follow Jennifer and share with you information about our health center, who we are, what we do, and who we serve. So Lifelong's mission is to provide, this is the mission as is written. Our board of directors worked very hard to put it together so that people could get at a glance exactly what it is that we do. But in a nutshell, what I always say that we do is we provide comprehensive medical care primarily to individuals who are uninsured or underinsured and who has not had the ability to afford access to care. So we provide high quality health and social services to underserved people of all ages. And we create models of care for the elderly, people with disabilities and families. And we advocate for continuous improvement in the health of our communities, which is very important to our organization. And our values, I highlighted in red the ones that we try to focus on the most. And so I'll let you read those: the diversity of the staff that we have at our organization and the diverse community that we work with. And we try to do this in collaboration with our local, state, and national partners. But we want to make sure that we respect the communities that we serve and participate in a way that really encourages our community to be healthy. So lifelong medical care, and I'm saying lifelong medical care, but most of you, if you're in this area, you've heard of Brookside, and I'll get to that. But lifelong medical care is a community health center where our first organization that we founded was the Over 60 Health Center. That was founded by the Gray Panthers, who really did fashion themselves after the Black Panthers. It was really about advocacy. And one of those advocacies as the Gray Panthers was, how do we ensure that individuals as they age can age independently and have the option to do so without being in an institution? So that's actually how we started our first health center, Over 60 Health Center. We had nurses that went around to senior centers, and we still have that, where our nurses go to senior centers and provide medical services for our seniors. We then hired the first male within the organization who was a doctor, and so we became Over 60 Health Center. We then later on merged with two other health centers, primarily Berkeley Primary Care Access Clinic in Berkeley. That health center focused on prenatal services. It was another clinic that actually was founded when Herrick Hospital closed in Berkeley. And Herrick Hospital, if any of you know about the history of that, was a hospital that actually provided services to the uninsured population at that time as well. When it closed, it was taken over by Alta Bates, and the Berkeley Primary Care Access Clinic was developed. We also then merged in 1996 with another health center, West Berkeley Health Center, which focused on adult care. So when we merged with all of those health centers, we became lifelong medical care, hence the name. And as our board of directors says, that gave us the name that showcases what we really do. We provide services, again, as I mentioned, of all ages, and that some people say from cradle to grave. So now we have 11 primary care facilities. We also operate an adult day health center. Unfortunately, with the government taking that services away, we only have one. We did have two adult day health centers, but we have one now in Marin. We operate school-based clinics. We have two dental clinics, a mobile dental van, which focuses on ensuring that kids who need access to dental care get those services. And then we have a supportive housing program. In 2012, Brookside Community Health Center actually became a part of lifelong medical care. Additionally, we also took over a very prominent practice in the area, Dr. William Jenkins. He was providing pediatric services for almost 40 years. So now his practice is also now a part of our lifelong medical care family. So in the Contra Costa area in San Pablo and Richmond, we have our Brookside Community Health Centers. We have Lifelong Richmond, which tries to focus on primarily ensuring that seniors get access to care and understand the services that are available to them. We're sharing that practice with Dr. Brazil Carter on McDonald. We have the Dr. William Jenkins pediatric practice as well. as well as our Brookside Richmond site, which is located around the corner from the Kaiser Richmond facility. So again, the services that we provide, comprehensive health care for individuals who are uninsured or underinsured. So again, we're very happy to be a part of the Contra Costa County community and working here in Richmond with Brookside Health Center. And this is just a map of where our facilities are located throughout Alameda County and Contra Costa County. Federally qualified health centers, you may hear that name a lot, especially since the passage of the Affordable Care Act. It's a federally qualified health center, and that we're a nonprofit community health center. Again, you'll keep hearing me say who we serve, underserved populations. What's unique about our organization as well is that our board of directors has to be at least 51% of patients who actually utilize our facilities, which is very good for an organization because the board of directors sets the strategic direction for the organization. So it's best to have individuals who are actually utilizing our services to set the direction of the organization's future. We provide services regardless of your ability to pay. It's not a free clinic, so we do offer our services based upon a sliding fee scale that depends on your family size and your income. And so the difference from a private doctor's facility and a federally qualified health center is that, again, as I mentioned, we have to have 51% of our board of directors be patients. We focus on the population of the diverse population of our community and try to reflect that in our staffing. And we're committed to improving not only the health care of our patients, but also the health care of our community. It's very important that we work with our partners, including the county, the cities of Richmond and San Pablo, to ensure that we're meeting the needs of the community. And we also offer enabling services in order to do that, meaning that we have health educators, patient advocates, we have enrollers who assist individuals to understand what programs they may qualify for. So those are the enabling services that we ensure that we have at our facilities so that individuals are able to access care, as well as providing services that are in the language that the individual speaks, as well as having interpreters available. So this is our current breakdown of the population that we serve. As I mentioned, pretty diverse, and this includes all of our facilities between Alameda and Contra Costa County. So our overall mission is leading a way to a healthy community by eliminating health disparities and empowering patients to optimize their health. Not only optimizing our patients' health, but actually understanding what programs they're available to. So in order to live a healthy life, unfortunately in the US, you have to have access to health insurance. So this is why this is very important to us to be here today to let you all know that our organization is here to assist you in whatever way we can in order for you to learn more about the Affordable Care Act as well as about the services that we provide. So again, this just reiterates what I just said. We want to educate you about healthcare reform because there's a lot of misinformation out there. We actually have been trying to encourage individuals to sign up for LIP, the program that Jennifer mentioned earlier, for the past 2 years. So those individuals, particularly if you're uninsured, where you have an income of $1,300 a month or less, you need to be enrolled in this program yesterday. So we're really asking individuals to really spread the word for those individuals who now qualify for Medi-Cal expansion, because they can do that right now, even before Covered California came into place. But for those individuals, we need to spread the word. If you are between the ages of 19 and 64 and you have no insurance and you're low income, you need to contact Lifelong Medical Care or Covered California right away so that you can start getting services today. Because the thing is, we want individuals to have access to health care insurance before they get sick, before you get sick. Because there's too much pressure trying to figure out how you're going to pay for services now that you're sick. So we really encourage you to find a provider, hopefully Lifelong Medical Care, but find and seek a provider so that you can have that relationship while you're healthy, so that you can get the preventative services that you need and live a healthier life, and then know where you can go in case you're sick. So that's what we are trying to encourage individuals to do today. And then sharing that with your family and friends, right? So the information that you're hearing today, you're going to go and tell how many people? 10, right? So pass it along to everyone at your church, your beauty salon, wherever you go, so that people can get the right information that there are benefits to Obamacare. So that's my presentation. Thank you very much.
Thank you. So we're going to go ahead and wrap up the presentation component of our presentation today. If you would like to sign up for appointments with Lifelong Medical Care to obtain additional information about the Affordable Care Act and enrollment, Luis and Nora are here. They have on the blue and white shirts. You can see them after the presentation, and you can sign up for an appointment to meet with them. Also, before you leave, please, if you can turn over the translation equipment to Gabino. He's here with the green shirt on. This presentation will be available for your review on KCRT, and all of the information will be posted online at richmondhealth.org. Thank you and have a good day.